recording.
Good morning, everyone. This is Michelle. Thanks for being here this morning. Casey and I are going to be presenting some updates that we've made to the assessment, including a new pre-diabetes screen and a new alternative assessment workflow. So here's our agenda for the day. So Casey will review the pre-diabetes screen and the protocol around that. And then we'll get into this nitty-gritty of the alternative workflow around the assessments, the different pieces of it. We'll go over some questions. And then there's some other minor assessment updates that have been made. And so we'll review those briefly, and then we'll go over next steps. Next slide. All right, so Casey's going to walk us through the pre-diabetes.
Thanks, Michelle. So to start with, I just wanted to remind everyone of why we are doing this. And this slide just shows some recent data from the CDC that in the United States, there's 30.3 million people with diabetes, and 1 in 4 of them don't know that they have diabetes. There's also 84.1 million, which is more than 1 out of 3 adults who have pre-diabetes, and 9 out of 10 of them don't know they have it. So the intention of adding this pre-diabetes screen to the assessment is to help identify participants who might have pre-diabetes or even diabetes and not know it. And the longer diagnosis is delayed, the more damage happens to the body, and diagnosis provides participants with the opportunity to make changes to improve the quality of their lives. The intention of this change to the assessment is to formalize our work capturing participants with undiagnosed diabetes and prediabetes, and that's why we are adding this to the assessment. This is the American Diabetes Association Prediabetes Risk Test that we're adding, and it will go into the assessment starting August 1st. It's to be done only with participants who do not already have a diagnosis of diabetes and prediabetes. So the purpose is to identify participants who are undiagnosed. The screen can be given to participants as part of the pre-assessment packet that Michelle is going to talk about for them to complete on their own. The screen is going to look a little bit different in the paper assessment, but we ask that the nurses carry copies of this screen with you to share with participants and to leave with them. Next slide. This is how the screen will look in the new version of the assessment. There are 7 questions: age, gender, history of gestational diabetes, family history, diagnosis of high blood pressure, physical activity, and weight status. And I think best practice is going to be to do this with the participant, show them the screen, talk about risk factors. This is a great opportunity for education. And I want to demonstrate quickly how we will use this. So for question 1, we probably already know the participant's age, but if not, we'll need to ask. For question 2, we know from our SASH coordinator training last week that question 2 is not always straightforward, but it will be for the majority of our participants. For this example, we'll say our participant is female, and this is a self-screen that we're helping with, so circle whichever the participant says. For the 3rd question, we're asking about gestational diabetes, and our imaginary participant is going to say no history of gestational diabetes. For question 4, a family history, our imaginary participant says their mother had diabetes. Question 5, about blood pressure. Again, you may already know the answer to this from earlier in the assessment. And for this one, we say yes. And for 6, again, show this screen to your participant. Physical activity is a judgment call. Let the participant decide. It's a self-screen. So if they think they're physically active, then the answer is yes. And for the final question, you've already gathered the data for height and weight. So you can show them the chart, show them how you calculate the points. We're going to say that this participant is 5'5" and 186 pounds, which gives her 2 points. And then we're going to total the score. We got 2 points for weight and height, and then the total score is 7. So participants who score 5 or more are considered at risk for prediabetes and should have further evaluation by their PCP if that hasn't already been done by them. So best practice is to give the participant a copy of this screen to take with them to the doctor. The wellness nurse can also fax or call the doctor with this information if you don't think the participant is going to follow up or if you have real big concerns for this participant. I want to remind you about this fact sheet that is available on STAR that you can use to fax your concerns to the doctor. There is also on STAR the elevator speech example if you prefer to call. So to enter this information into PHL, there will be a single question added. And again, this is starting August 1st. There's a new tab that's going to be called Pre-Diabetes Risk. It's going to be right here. And it will say ADA Pre-Diabetes Risk Score. That's what it says, Pre-Diabetes Risk. So our imaginary participant scored a 7. The way this is going to work is when you open that tab, there will be a drop-down menu with answer values 1 through 10. So it will ask you just to enter the final score. We can't put a 0 in, so you'll have to put in a 1 and put in your notes if it's a 0. I think zeros are going to be fairly rare. Next slide. This is the protocol to go with this new screen. It's pretty simple. It's going to be posted on STAR, and hopefully it's all things you're doing already. So we'll perform the screen at initial assessment and at all reassessments for all participants, again, without a diagnosis of diabetes or prediabetes. Our imaginary participant had a score of 7, putting her at risk for prediabetes. So the wellness nurse will give a copy of the screen to the participant. We're asking you to carry these copies. Encourage the participant to take the screen to their PCP. Consider contacting the PCP by fax or phone yourself. And finally, refer this participant to a DPP, diabetes prevention class. Remember that there does not need to be a class scheduled for you to do a referral. That they collect the referrals and then might even set up a class when they get enough of them. So please refer people to those programs.
Hey, Casey, you got a question in from Diana asking, will the coordinator or the nurse contact the doctor?
It can be either one. And the coordinator can certainly help a participant do this screen also, as long as the nurses get a copy of it, see the results of it. Either one could contact the doctor and send a copy of it to the doctor. And then the last thing on this protocol is to encourage healthy lifestyle changes, and that's whether somebody scores at risk or not, going over healthy lifestyle changes with folks, either as you're doing the screen or afterwards, and providing some education around that.
Casey, is there any advice for folks that are working outside of Vermont as far as the prediabetes classes and education?
The diabetes prevention program classes are nationwide. I'm not sure how they're being offered in other states, but it is a national program.
I would have to check with their local departments of health.
Yes, check with the local Department of Health, Molly. That's a great idea. It is definitely national and happening everywhere. And next slide.
We've got one more question. Colleen says, all my participants are 60 and older. Should we contact the PCPs for all of them?
So with this screen, being over 60 only gives you 3 points. So you are under the at-risk category. So it depends on the answers to the other questions, which is why we're using this particular screen. So if they're over 60 and overweight, then they might have a score of 6, and then yes, you would refer them. If they're over 60 but healthy and active and not overweight and don't have a family history, then they are not at risk and you would not refer. So go through the screen, and only folks over 5 would need to be referred to the doctor. Next screen. I wanted to pause here for questions. There you go. Because I'm going to be sneaking out shortly, so I wanted to pause to see if there were specific questions about this screen. It's also going to be available, the prediabetes risk screen is also going to be in the new pre-assessment workflow that Michelle's going to talk about next. And like the fall screen and the nutrition screens, self-administration of these tools provides education and an opportunity for reflection for the participant. So this screen, as with the other screen, should be reviewed by the wellness nurse and any concerns discussed with the participant. So before Michelle takes over and starts talking about that new assessment workflow, I wanted to see if there were any other questions on the pre-diabetes screen and adding that into the assessment.
I don't see any other questions right now. Give you all a couple more seconds to type them in if you have them. Colleen says, I have a question on PHL and diabetes. What's that, Colleen?
Can we unmute her?
She says you have some folks that are not diabetic and it shows that they are. Why don't you call the help desk and we'll do some troubleshooting with you on that. Great.
Okay, thank you, everybody. I'm going to turn it over to Michelle.
Thanks, Casey. All right. So we are moving along to this new alternative assessment workflow. And I'm sure some of you are wondering why we are doing this. So this idea came up, it probably started close to a year ago, where we kept hearing that, you know, wellness nurses, we all know that you have limited hours and we ask a lot of you. And so we're trying to just brainstorm, how can we help you guys feel like you have, you know, can make the best use of your time. So we've heard that, you know, getting all assessments done annually can be tricky, and our data really backs that up. You guys are doing amazing work, and it's still, you know, tough for a lot of the panels to stay on top of assessments all of the time. So about, I guess it was earlier this year, we ran a small pilot of this alternative workflow, and the pilot showed that this new workflow really did save the nurses some time. And another result of the pilot was that we had some participants who didn't traditionally engage in assessments. I think we all have, you know, at least a couple of participants who decline assessments. I don't really need it. I don't have time for that. They were more willing to engage in this process as well. So I won't read this slide out to you, but you can kind of see the why. The wellness nurse, we ask more and more of you. In fact, we're adding a new screen for you. So we ask more and more of you all the time, and we were finding that the amount of information we were getting from the assessments was declining. Okay, next slide. So we're kind of the language I'm using around this is the traditional assessment is what we've been doing up until this point. And it's not the assessment that's changed, it's just the workflow, really. So the traditional SASH coordinator assessment and the traditional wellness nurse assessment in the green boxes, and then the teal boxes show where that data kind of goes. So all of the data collected in the traditional SASH coordinator assessment is still going to be collected in the alternative SASH coordinator assessment. So that doesn't change a whole lot. However, you can see that the traditional wellness nurse assessment, all that information that you guys have traditionally collected has been split out into these other three things. So the alternative SASH coordinator assessment, something called the pre-assessment, and the alternative wellness nurse assessment. So next slide. We'll go over the pre-assessment first. So what is it? It is a 6-page questionnaire that will either be filled out by the participant alone or with assistance, depending on their ability and willingness. So for community-based panels, you might have to be a little bit more creative. You know, you might have to mail them out ahead of time or be mindful about how you get these assessments to your participants, and that's just something that you can play around with. Okay. And then who, that's really up to you guys. You know who your participants are, you know their abilities. So if you feel like you have a participant who would be completely willing and able to fill out a form by themselves, by all means use that for that participant. And then how, like I mentioned, community participants, you'll probably want to give them a call and say, hey, I'm sending you something in the mail. Do you mind filling that out before the wellness nurse comes to see you? And then for participants living in hub sites, it's going to be a lot more simple. You can just hand deliver it to them. And I put SASH coordinator there, but wellness nurse is fine too. I'm just, again, the focus of this is to lighten the load of our wellness nurses. So when, this is the important part, is so the self-completing participants should return pre-assessments to SASH staff prior to the wellness nurse assessment. It's really not connected to the SASH coordinator assessment at all. So there are some of you where the wellness nurse and the SASH coordinator go together and do assessments at the same time. And then there's other panels where you two are on completely different schedules. So just make sure that the pre-assessment goes out before the wellness nurse assessment. And then if a participant is not able or forgets or for whatever reason doesn't get that pre-assessment done before the wellness nurse gets there, the wellness nurse can help the participant during the wellness nurse assessment. Or another example might be a participant might come back down to the office and ask the SASH coordinator for assistance in filling it out, and that's absolutely fine as well. And if it is done during the assessment with the wellness nurse should just read the questions aloud as though it were part of the normal assessment. And if you haven't received it back from the participant prior to, it's always best practice to bring another copy of the pre-assessment with you, just in case they lost theirs.
We did have a couple of questions and comments come in when you were going over this stuff. Amy was wondering if you could point out the difference between this workflow and how it is now. I believe that's what you were getting at, Amy. Oh, sorry. That was not, I was just reading a question incorrectly. Ignore that. Colleen wanted to point out that her own workload feels pretty big right now and that it's increasing. And Michelle Whitney is wondering, is this the same pre-assessment that was used for the pilot?
Yes, we're going to take a look at it in just a minute, and I think you will recognize it, Michelle. And Colleen, I hear you. I'll throw out there right now that this is not mandatory. This is just an option. So if you are finding that the traditional workflow works best for you and your team, that's fantastic. If it's not broken, we don't have to fix it. This is just an option. Thanks, guys. Okay, so now we're going to look at the pre-assessment. Like I said, it's 6 pages long, and it contains screens and parts of screens that all come from the wellness nurse assessment traditionally. All of these screens were chosen because the screens themselves were designed to be self-administered. So I did a lot of research to make sure that we weren't asking participants to do things that a clinician really should be administering. So all of the questions and screens in here is really okay. The research says it's fine for people to answer themselves. So the first thing that we have here, let me point out, so we have the participant name and date, and then I encourage you, when you give the pre-assessment to the participant, to write in the date of their upcoming assessment. So not only does that help, make sure that you have that scheduled, it's also like a little reminder card for them. Hey, the nurse is coming in 2 weeks. Here's the date that the nurse is coming. And then just instructions, please complete this questionnaire and return it to your SASH coordinator or wellness nurse prior to your schedule assessment. So the first one is the Falls Risk Assessment, just as it's in a larger font, but it is the exact same screen as we have traditionally used. And that's a continuation of that Falls Risk Assessment. The question, do you mind going back a second? That question down there, how would you rate your health? That comes from the very first question on the general health assessment that the nurse would generally answer during their assessment. And then we have this next chart. The first 2 squares, or the first 2 rows, are the PHQ-2, and the next 2 rows are the GAD-2. So I just kind of lumped them together, but that's just because that's how you would answer them is exactly the same. So those are taken care of. We ask about substance use and alcohol use. And just as a side note, we were kind of hoping that perhaps we would get more honest answers as well. If somebody is able to fill this out in the privacy of their own home, not be put on the spot to answer in front of somebody, that maybe we get, more accurate data as well. They'd be more willing to talk about these things and share that with us in this format.
I have another comment from Colleen asking, do other panels actually schedule that far in advance? If I schedule more than a few days ahead, they forget and usually are not home.
I believe they do. In my experience, it's some panels it works for them to schedule far in advance. I remember I used to schedule up to a month in advance, and it definitely, you know your people, you know your panel and what works for you. So by all means, if anything about this just doesn't jive with you, you certainly don't have to use it. And then the nutrition assessment is included in here, pretty straightforward. And then we add the pre-diabetes risk test. So it does look a little different than the pretty ADA one, but it's in a larger font. And so we do encourage them to add up their points here. And then on the the very last page is just the chart with the height and the weight. So they can reference that and then add it up themselves. So that is the entirety of the pre-assessment. And like the prompt says, ideally the participant would return it to the SASH coordinator or wellness nurse. And of course, if they had questions, we would encourage them to reach out to you guys for assistance. And worst case scenario, it doesn't get done, and the wellness nurse can fill out these screens with the participant during the wellness nurse assessment. It wouldn't be any, additional work or time than the traditional wellness nurse assessment, because all those questions are usually asked during that time anyway.
I have one comment from Michelle Whitney, who I believe was a part of the pilot. Is that correct?
Yep.
Just saying that Michelle really loved the form and her panel thought it was great. So,
thanks, Michelle. Yeah, I know there are a few of you on the call this morning who are part of the pilot, and if any of you want to chat in and just share your thoughts about it, or things you learned about it, or ideas, workflow, even recommendations, just please feel free to chat in at any time. Okay, so next slide. Just while you guys, I know this is really small, but I just wanted to show you that I've put together a guide for entering this into PHL, because it is a little bit all over the place, which is the challenging part about this. If you are not super comfortable with PHL, it takes a little bit of time to learn, okay, well, where does this question get entered? Because we did kind of pick apart the general health assessment and pull it out into little pieces. So I made this guide if you would find that helpful, basically where you would enter certain questions. So for example, on the second page in the middle there, how would you rate your health? In red, it says, please enter into the general health assessment tab. So basically, I just put kind of instructions for each one of these screens. And for some of you who are super comfortable in PHL, you may not need this, but this will be available to you.
We have a little more comment in from Kim Russell saying that Kim was involved in the pilot and she liked the pre-assessment a lot and it saved a lot of time.
Thanks, Kim. And Kim has a full community panel. So I was, it's great to hear that even with that extra work around, serving participants in the community, that it still saved you time. Thank you very much, Kim.
Can I just add too, Michelle, that this is Casey. One of the things the nurses have been asking for quite a while is to have the PQ2 and the anxiety screen together, because they make sense for them to be together, and now they are in this form. So I think that's really awesome.
Cool, thank you.
And Michelle Whitney is chiming in again, saying that it did save a lot of time and it wasn't too bad to put it into PHL, which is great.
Great. Thank you. All right, so after you do the pre-assessment, you still have the full assessment to go over. So what is it? And how does it differ from our assessment right now? So simply put, it's just a restructured traditional SASH assessment that moves some of the screening tools over from the wellness nurse to the SASH coordinator assessment. And so we will walk through what screens moved. We'll basically walk through the SASH coordinator assessment first, and then the wellness nurse. So this is the SASH coordinator. These first couple pages are pretty much the same. So you have the client demographics, contact information, insurance information, support contacts for the participants. All right, and next page. We did move, so this is the first thing that we changed. We moved the immunizations over to the SASH coordinator. And you'll see up in the upper left-hand corner, we put little cheat things. So some of these pharmaceutical names can be long, and not that I know as a non-clinician can be a little confusing what they are. So if somebody said they had the Zostavax vaccine, I have no idea what that is. So I put in a little note that says, it's a shingles shot that's been used since 2006. So you can, hopefully that will be helpful with you navigating that. And if you ever have questions, you can just, kind of jot down a note and talk to your nurse about it. And just as a note, so there's, for both pneumonia and shingles, if the participant doesn't know whether they had the Shingrix or the Zostavax, they just are like, I had a shingles vaccine. That's when you would choose the shingles. It's unspecified which one they had. And then we have the clinicians. So the SASH coordinator would collect information about the participant's clinicians. On page 3, and then page 4, we have the ADL tab and the IADL tab, which is new. The SASH coordinator assessment was back there. So the Lubin scale and the UCLA loneliness scale currently, they show up on both the SASH coordinator and the wellness nurse tabs or assessments, but in this alternative workflow, it only shows up on the SASH coordinator side. And then we have a space to document those referrals that generally get put in the SASH coordinator assessment. And then we have the CSSRS in here. That is only on the SASH coordinator assessment this time around. That's another thing we handed over to that specifically. There's another little spot for the person-centered interview. If you haven't already done that, with a participant, this is just a way to kind of jog your, just a little reminder, like if you haven't collected this information, like make time to do that, or even start it right now. And then the last 2 pages are just a copy of an individual healthy living plan form in hopes that you can spend the time to create that. And if your workflow is different and you do that in a separate appointment, that's totally fine. This is, again, is just more of like a tool in hopes that it would be helpful for some of you just to get it done. So here's the wellness nurse alternative. So nothing is new with the wellness nurse assessment. It's just shorter because a lot of those screens ended up on the pre-screen and with the SASH coordinator. So you're still going to collect the diagnoses information on page 1. Page 2, you have medications and medication adherence. Allergies, intolerances, vitals. The general health assessment tab, some of these questions got bumped out to that pre-assessment, so you can see question 1 is crossed out and it says, this question is completed in the pre-assessment, please enter it in PHL. And then if you skip down just past question 8, you can see where the GAD-2 usually is. There's just a note reminding you that it's in the pre-assessment and that if they scored a 2 or higher, please continue on with the GAD-7. A note about the SASH coordinator doing the CSSRS, and then the substance use is also done in pre-assessment, asking how to document that and how to provide education surrounding that. And then you are asking about tobacco, and the rest of that the general health assessment is unchanged. We are asking about the false history. The mini cog is there. And then you'll see in yellow on the right, basically anything beyond that point are follow-up screens that you will do with some participants and you won't. So we provided the PHQ-9, the GAD-7, SMAS-G, the audit tab, and the DAST-10. And then the very last thing that we did is leave a blank page on the back for the clock drawing for the mini cog, so that you don't have a loose piece of paper hanging around. Hopefully it's just stapled together with the rest of your paper assessment. So that is the alternative wellness nurse assessment workflow. And this one doesn't include a healthy living plan. I know some nurses, that is part of their workflow currently, and you can decide if you want to still continue doing that, and it's just not part of the assessment right now.
We have a couple of questions and comments that have come in. One from Karen Lipinski saying this seems smart and useful. Thanks.
Thank you.
And one from Colleen asking, why don't the SASH coordinators conduct the mini cog?
That's a good question. I feel, well, actually, maybe Casey has better insight into this. It's my understanding that it really needs to be administered by a clinician.
Yeah, that's a screen that needs to be done by the nurses, and the nurses receive training in how to do that as part of their onboarding with SASH. So that is a screen that we want the nurses to do, the way it's set up.
Great. And lastly, Kim Russell says, I like it.
Thanks, Kim. All right. So the next slide is just kind of going over that workflow one more time, because this is the part, the workflow is really what makes or breaks this. So I'm just going to go over it one more time. So pre-assessment should be completed and returned to SASH staff prior to the wellness nurse assessment. If it doesn't happen, then the wellness nurse should bring a blank pre-assessment to the appointment in case that it was lost. The pre-assessment may be completed with SASH staff if the participant is brand new to the SASH program. You don't want to assume literacy and comprehension abilities. If it's somebody who's lived in your building, you're in a hub site and you kind of know them, that's one thing. But if you get a brand new referral from the community and you don't know anything, you might not want to just send them something blindly in the mail and set them up for failure. So just be mindful of that. The participant can decline to fill it out ahead of time. That's absolutely fine. Or if the participant is unable to for whatever reason. And then just a note that the SASH coordinator assessment can occur anytime independently of the pre-assessment and wellness nurse assessment. that's that workflow. And then I did put it into a visual just for visual learners, and there will be a just a copy of this on STAR if you'd like to. But this is the same thing I just went through, just in visual form. Okay. So I came up with some questions I thought might pop up. And so the first question is, and I've already covered this, do we have to use the new alternative workflow? And the answer is absolutely not. The alternative assessment workflow is completely optional. If the traditional assessment is working for your panel, there's no need to change it. We just wanted to give our staff more options. Next. Is there a difference between the data we collect with the alternative workflow versus the traditional workflow? And the answer to that, again, is nope. The contents of the assessment haven't changed. It's just how it's collected and by whom. All right, next question. I love this. When can we start using the alternative assessment workflow? And the answer to that is August 1st. So there will be a spot on STAR in the PHL page and under SASH tools where you would normally go to print off your assessment. There will be another little section with alternative assessment workflow materials that will all live there. It will not pop up before then. Yeah, that's all I have to say about that. Okay. Who enters the pre-assessment into PHL? So I'm leaving this one up to you guys. If the wellness nurse feels as though entering it into PHL really helps them to make sure that they get their eyes on this pre-assessment before they go out, that's fine. If it doesn't get until PHL until after the wellness nurse assessment, that's fine. Whatever works best for your team. I'm leaving some of this in your hands. You guys know your workflow currently. You know how things work better than I do, so I'm not going to tell you how to do that. This is similar. This has changed how data is entered into PHL. And I said whatever works. It's flexible or whatever works. The wellness nurse and SASH coordinator can enter the pre-assessment, but remember that the wellness nurse should be entering the medications, the mini-cog, and the chronic conditions at the very least. All right. So those are all we'll have a chance for more questions too.
Do you want to do more questions?
Yeah,
now?
sure. Why not?
Okay. We do have a couple that came in. MJ said, looks good. Thanks for your hard work. Michelle Whitney says, are we going to be able to use the pre-assessment instead of the long assessment for low-need participants?
That's a great question, Michelle. So in the pilot, there was another section of this pilot that didn't get integrated into this new workflow. And just so the rest of you know who were involved, some of that was based on kind of the need or risk level of the participant getting a different kind of assessment at different times. And that has not been adopted, Michelle. So what we're still asking that all participants have a full assessment, whether it's the traditional workflow or the alternative workflow, every year, regardless of need level. I hope that makes sense.
Sonia Brown asks, can we have a copy of your slide presentation?
Yeah, this call is recorded, and the PowerPoint will also be available, absolutely, and it will get emailed out after the call as well. Great question. Okay, so as many of you likely know, we are now, as an admin team, updating the assessment once approximately every quarter, so that there's not a zillion little changes all the time. So this update was pretty significant, obviously, with the pre-diabetes screen and with this alternative workflow, but we actually did make a few other little changes I just wanted to make you aware of. So we added some race options under the demographics. So we have two new options, Middle Eastern or North African. And you can also circle two or more, there's an option that says 2 or more races. so we can more accurately capture that demographic information about our participants. Another change we had was healthcare directives language. So here in Vermont, we call our advanced directives, but other states don't always use that language. There are other states with similar documents that call them healthcare directives. So you'll see in the questions in the SASH coordinator assessment where it says, do you have an advanced directive? It will say, do you have an advanced directive / healthcare directive? So that's where that came from. Changes in vaccinations, so that just the location moved. We moved that earlier in the screen or earlier into the assessment because that tab is not in with the visits, it's out with the participants' demographics, and we thought maybe it would save you an extra few clicks from clicking back and forth when entering it into PHL. And we added those prompts or the little hints to the alternative SASH coordinator assessment. So the mini-cog scoring and sheet, so we added a little bit more detail in the scoring on the paper assessment. We've always, in PHL, there's a little bit more in-depth scoring information, and we were missing that in the paper assessment. So there's an explanation on how to score the clock. And as you saw, we added a blank sheet for the clock drawing, and we did that in both versions of the assessment. The Healthy Living Plan sheet has been added to all of the assessments except for the Alternative Wellness Nurse one. And the last thing is the opioid education. So we have a new ask surrounding that. You can go to the next slide. So it's related to a grant deliverable that we have. We shortly will be getting all of you copies of a brochure about using, medication or generally opioid medication and just in a responsible manner in an effort to reduce misuse and abuse among our participants. So we are already asking participants if they have used an illegal or prescription medication for non-medical reasons at least once in the past year, and that shows up on the pre-assessment. So if they say one or more, you already would go to the DAS-10 and screen them, but we're now asking that you would offer them education surrounding this. And in addition, we would ask you to offer education if the participant is currently prescribed an opioid medication. So when you collect their medication list, if you see that they're taking one of these drugs that, we just want to make sure that they're doing so safely and that they're aware of the risks involved. So stay tuned. There's more coming as far as the brochure goes.
Michelle, that's a digital brochure that we're going to be getting, folks.
Oh, is it?
Correct?
That's news to me. We'll sort this out.
I guess that was a question.
Okay. Oh, okay.
From myself.
Oh, okay.
Is it a digital or a paper brochure that we're going to get to staff?
We're going to be both.
Okay.
The alcohol one is, because currently the alcohol brochure, you can hand to them or you can print it off with STAR. So I'm pretty sure we're going to try to do that same format.
Okay, so Molly, in case you could not hear Molly, she was saying it'll be similar to how the alcohol brochure works, that you could print it off digitally off of STAR, or, we provided physical copies, so it'll be the same with this opioid education brochure as well.
Is there any guidance for Rhode Island and Minnesota folks on, I know this will be Vermont Health branded.
It is. I would encourage non-Vermont staff to reach out to your Department of Health. I'm sure that they have some education, and if they don't, they should. So it's a great opportunity to have a conversation about these important issues with your Department of Health and make sure that they do have these sorts of things.
And this is Molly. I totally agree with Michelle's suggestion, and also when we looked at the alcohol brochure and kind of drafts of the opioid ones, most of the information is general information that will be useful no matter what state you live in. But the way because these are developed in partnership with the Vermont Department of Health, there are specific references to Vermont resources, sprinkled in it, but the key content about risk and that kind of stuff is universal, but it's definitely something that you could share the brochures, for those of you in Rhode Island and Minnesota, with your state departments of health and see what they have that's similar, or hopefully they'd be like, wow, Vermont created something really cool. I want to do the same thing. So maybe that could kind of just get that ball rolling.
Great. We will let you know when those are available.
Thank you. All right. Next slide, please. So here's just some next steps after this call, because we've just given you a ton of information. I really want to encourage the SASH coordinator and wellness nurses at each panel to get together and have a conversation. Think about this alternative workflow if you want to give it a shot, or if you feel like, hey, we're in good shape. And if you decide to implement the new workflow, make a plan. You have to you have to look ahead, like who's coming up for an assessment, who's going to get them the pre-assessment, what's the timeline around that. There's just a lot of collaboration that needs to help. Like I said earlier, it's really the workflow is going to make or break the success of it. So you guys working as teams is really important. And then determine a start date. So it won't be available until August 1st, but if you decide, hey, I have a vacation in September and this is, let's push it off. Let's start it in October. You can totally do that. You could say, hey, let's try this for 2-3 months and then, reevaluate. But I really just encourage all of you to have those conversations between yourselves. If there's any lingering questions or questions come up about the prediabetes risk screen, please reach out to Casey, and she will definitely help you out there. And if you have any questions about this alternative workflow, you can reach out to me. And I will try to help you out and talk you through it. All right. Any final questions?
We do have a few final questions. One from Kenneth about healthy living plans. He's asking if we're still not able to use the golden barriers tabs in PHL. That's correct, Kenneth. Those tabs do not work very well and they cause a lot of frustration. We believe that doing them on paper is the best workflow still going forward, unfortunately. Kim Russell says, Casey and I have done a training on opioids and some didn't know what an opioid was, and it did help one of our participants with a grandson.
Awesome.
Great. Maxine Adams says, how would we give a copy to the participants of the pre-diabetes screen?
That's a great question, Maxine. So if you are using the alternative workflow, the diabetes screen is included in that pre-assessment. So they would fill it out themselves. And if they were to score a 5 or higher, the wellness nurse, when the wellness nurse comes to do their assessment, the wellness nurse would be carrying around another copy of that pre-assessment, the diabetes risk test, and basically fill out a duplicate copy of it, which will only just take a second because you have all the answers. And you leave that copy with the participant and say, please share this with your primary care physician. Does that answer your question, Maxine? Perfect.
Any last questions before we sign off for today? Holly has a question.
Well, I don't actually have a question, but I have a comment. So if there are any other questions, don't wait. Okay. I just wanted to take a moment to thank Michelle in particular for leading this effort. She mentioned that it's been a year. I think it's been a little bit over a year in preparation. And I know that may seem funny, but it's actually very intentional that we took a lot of time, and we got a lot of, I want to thank a lot of other people that worked closely with Michelle on this. So we spent a couple of segments of our implementation manager in-person meetings to brainstorm this, to get feedback. We had, pieces of paper up on the walls, getting feedback about this. So I want to thank the implementation managers for their input. I want to thank the pilot staff out of the different sites that we learned so much from your experiences. We appreciated your transparency and what you shared. Really want to also thank those participants that did these, because this is how programs like SASH continue to evolve and improve. And it does take time, and it does take patience, and it does take perseverance. And Michelle just did a fantastic job leading this effort. And you can see from this presentation the care that she puts into this and the thoughtfulness. She has a ton of respect for the work that you all do there, and so she's so thoughtful because of that. So anyway, thank you to all of you that had a part in this, and so many of you did. And I really do encourage you, to give the alternative a shot. Even, I know change is hard, but we did hear from those that did it that it actually did save time, increased some autonomy of our participants. So that's what I wanted to say. So thank you, Michelle.
Thanks. All right, thank you, everyone. If there's any lingering questions, feel free to reach out to me. And hope you guys have a great rest of your day.